This video is on how to tell if your x-rays included the coccyx or tailbone. This is of course very important if you have tailbone pain and if you have x-rays done for that, or if you're going to have x-rays done for that, you want to make sure that the x-rays actually include the tailbone. I'm Dr. Patrick Foy, and I'm an MD or medical doctor specializing in pain management, and I'm an associate professor of physical medicine and rehabilitation. I'm director of the Coccyx Pain Service at a large medical university on the East Coast in the United States. And my website is tailbonedoctor.com. First of all, it's important to understand some of the basic terminology when it comes to the low back and spine region. Specifically, in this area of this spine model, this is the lumbar spine. The lumbar spine is the area from just below where your ribs attach to just at about the pelvis or belt line within your lower back. That's the lumbar spine. The next section is the sacrum. The sacrum is a series of bones that are fused together and they form the back part of the pelvis. And together with the lumbar spine they make up the lumbosacral region. Just realize that the lumbosacral region does not include the next section down, which is the coccyx or tailbone. I treat hundreds of patients every year for coccyx pain or tailbone pain, and you would be amazed how often people have had x-rays or MRI that have focused on the lumbar spine or the lumbosacral spine, even though their pain was down at the coccyx. So what should you do if you're a patient? Well, first of all, if you're about to have x-rays done, if your doctor is sending you for x-rays, or you're speaking with your doctor about the orders that they're writing for the x-rays, read the orders. If the doctor is checking off a box that says lumbosacral x-rays, that's not the coccyx. Lumbar spine or lumbosacral spine, it's not the coccyx. The other thing is, if you've had the x-rays done or if you're going to have them done, make sure you tell the radiology technician that the coccyx or tailbone is the main area of your pain, if that's really the case for you, and have them confirm that the x-rays that they're about to do are going to include that specific area. After you've had the x-rays done, one of the things that you can do is to get a copy of the official radiology report. So what did the radiologist say when he or she read the actual films? Did the radiologist actually even mention the coccyx? By getting a copy of the report from your doctor's office, have them photocopy it and send it to you, or give you a copy when you're there for your follow-up visit, and read it carefully. If they do not even mention the coccyx or tailbone within the report, there's a decent chance that they didn't mention it because it wasn't included in the first place. The other thing you can do is to get a copy of the actual images. For this, the radiology center may be able to just burn it onto a CD for you or loan you the actual films or images, and you can take a look at those and you can see whether you can actually see the tailbone included in those images or not. The other thing you can do is take those images with you to your doctor's visit and ask your doctor to specifically point to the spot where the tailbone is on the x-rays. Also, be ready to be shocked, because it is very, very common that when you and your doctor go to look at the x-rays and you've been told that everything's normal, it may very well be the case that the x-rays did not include the coccyx in the first place. The lumbar spine images will include up here. Lumbosacral spine will include, part way or most of the sacrum, but they won't include the coccyx. Or they'll just, part of the coccyx may come in on the edge of the image. So really, it's important to take responsibility, for this. Find out as much as you can. Read the orders, read the report, look at the images, and that will help you to know if you're suffering with tailbone pain and you're having x-rays done or had x-rays done, did they actually include the coccyx or tailbone in the first place? I also have images online that you can look to compare your x-rays with things that we have posted on the website, tailbonedoctor.com. Okay, just a couple of quick warnings and disclaimers about this video. Please realize that this video is meant for educational purposes. It's not meant to be specific medical advice for any individual. For that, you really would need to see a physician and be evaluated in person by a doctor experienced in treating tailbone pain. Also realize that tailbone pain sometimes can have some very serious causes. Things like cancer, malignancy, tumors, infection. So again, you owe it to yourself to have an in-person evaluation by a physician with experience in this area. Also, realize that tailbone pain is relatively uncommon compared to most other types of low back pain. So many doctors may be unfamiliar with how to properly and thoroughly evaluate tailbone pain, or they may be unfamiliar with some of the current treatments that are available. So you really may want to consider, if you're not getting the answers and the relief that you want, you may want to consider seeing a specialist who has particular expertise in the treatment of tailbone pain. For more information, please feel free to check out the website www.tailbonedoctor.com. Thank you. Hi, this video is on how to tell if your x-rays included the coccyx or tailbone. This is of course very important if you have tailbone pain, and if you have x-rays done for that, or if you're going to have x-rays done for that, you want to make sure that the x-rays actually include the tailbone. I'm Dr. Patrick Foy, and I'm an MD or medical doctor specializing in pain management, and I'm an associate professor of physical medicine and rehabilitation. I'm director of the Coccyx Pain Service at a large medical